Hello guys, my name is Phineas and welcome to I Am Phineas YouTube channel. If you're new here, please consider subscribing, hit the notification bell down below, like and share the video. Today, we are going to learn about urinary tract infection. What is urinary tract infection? Urinary tract infection is infection of any part of the urinary system, that is the bladder, ureter, urethra and the kidney. If you get infected in any of these parts of the kidneys, definitely you'll be having urinary tract infection. Urinary tract infection is caused by bacteria or like Escherichia coli, sexually transmitted infections like chlamydia, gonorrhea. Now, let us look at the types of urinary tract infections. Urinary tract infections are categorized according to the parts of the urinary system that is infected. You find that if it's the kidney it's infected, we tend to get what we call nephritis. If it's the bladder, we tend to get what we call cystitis. If it's the prostate, we tend to get what we call prostatitis. And if it's the urethra that is infected, you get urethritis. What are some of the symptoms one may experience if infected by urinary tract infection? One is burning sensation. 2. Frequency of micturition. 3. Persistent urge to urinate. 4. Blood in urine. 5. Cloudy urine. And 6. Lower abdominal pains, especially for women. Let us look at some of the risk factors that might predispose us to getting infected by urinary tract infection. And one is being a female. Understand the anatomy of the female is quite different from that of the male. This is because of the closeness of the anus and the birth canal, and also the distance or the short urethra of the female compared to that of the male, mostly predispose them to having to get infected by UTI. Another one is blockage of the urinary system, especially if you have tumors or you have kidney stones. You might also get infections because they tend to block the urine from flowing, thus creating a space or environment that might encourage development of infections. Another one is urinary tract abnormalities, especially for children who are born having urinary system abnormalities. This might also block the urine from flowing and might also create an environment that may predispose them to having or getting UTI. Another one is having suppressed immune system, people who are diabetic, HIV people, or people who are suffering from cancer may be at a high risk of acquiring or getting infected. Another category is women who have completed menopause may also get infected by UTI. You find that estrogen plays a big role in moderating so many functions in the body of women, and one of them is that it plays a big role in moderating urinary tract system, and so you find that you are at risk of acquiring urinary tract infections. And also people who are using catheters to urinate, especially people who have been hospitalized, or people who have got neurological problems or are paralyzed and now they are on rather a tube that helps them urinate, it tends to predispose them to UTIs. So that's all about the risk factors. Now let's look at the preventive measures, or rather lifestyle and home remedies that you can use to prevent ourselves from getting urinary tract infections. One of them is drinking a lot of water. Looks a simple method, but most of people don't adhere to this preventive measure because so many factors might lead to that. Maybe you reside in places where the climate does not allow you to take a lot of water. Maybe it's quite cold and you're not able to take water often, and this might predispose you to having urinary tract infections and even other problems. Water is quite important in our body, and we need to always teach or train ourselves to take water all the time so that we can avoid these diseases. Second one is avoiding feminine products that are irritative to your urinary system, especially the urethra. Especially ladies who use sprays and powders to your genitals, you might predispose yourself to UTIs. So if you are using such irritative products, it's quite advisable you stop using them because they are quite risk factors. Another one is it's always good to change your family planning methods, especially those who use diaphragms and spermicides as a family planning method. It's quite advisable to stop using them because they tend to irritate the urethra and you get predisposed to urinary tract infections. Empty your bladder as soon as you have intercourse and take at least a glass of water so that you can be able to flush the urine, that is to flush your urinary system of the microbes that might have set their way to the urinary system. And also you can look at the hygiene. Hygiene is quite important, especially for ladies, especially when you go to the long core and short core. Make sure you wipe yourself from front to back, not back to front, so that you can be able to eliminate the risk of transferring microbes that are in the GIT from the GIT to the genitals. So it's quite important to observe that hygienic measures, even if you're going to public utilities, especially toilets. Make sure you look at them because they tend to spread UTIs so much, because you might collect those microbes from such public facilities. And also those people who share bathrooms. Bathrooms are quite big spreaders of UTIs, especially those people who live where they share bathrooms in public. If those bathrooms are not kept hygienic, you might get UTI. Having discussed that, you find that if you don't treat UTI properly, you might get yourself into complications, and some of the complications that you may get are permanent kidney damage because of failure to get proper treatment. Another complication that you might get if you're pregnant, you may find that you may get a low birth weight baby or a premature infant because of UTI. That's why you find that when mothers go for ANC, they tend to be tested for urinary tract infections so that you may not predispose your child to such. Your doctor will tell you what the best treatment modality to use. So it's always good if you get UTI, make sure it is thoroughly treated. Make sure you observe the above measures we have just discussed so that you may not be experiencing such. Thank you so much guys for listening to this video. If you're new to this channel again, please consider subscribing. Ring the notification bell down below, like and share. Thank you so much. See you in the next video.